Hey, if you're just joining us here, Andrew Rubin's joining us. He is the VP of Clinical Affairs at NYU Langone Medical Center. He's also the host of on Sirius XM Doctor Radio. Andrew, good to see you again. We're answering questions that we solicited on our Facebook pages. Terrence has this question, says, how much is this fine for not taking health care? Does it apply to those who have no steady income, or in other words, no job?
The answer is people have to pay a fine, but there's some caveats to that. So it starts in 2014, and year one of that fine is $95. And it goes up each year. 2015, it's $325, and then 2016, $695. But if you have no income, you're actually exempt from paying the fine. So the threshold is if you're below the federal poverty level, which is about $9,600 this year, then you wouldn't actually have to pay the fine. You wouldn't have to pay the fine. Now, and the idea here also is that if you go out and buy insurance and you're below the poverty level or below 400% of the poverty level, I think, so maybe that's almost $20,000 a year, you actually get a subsidy from taxpayers to buy that insurance, right? That is correct. So one is the fine, and there's criteria for paying the fine. And then if you actually want insurance and you have no income, then you can go out on the exchanges in 2014 and buy insurance. And if you have no income, you're going to get a pretty hefty premium subsidy. Yeah, I want to be clear about this fine thing, because I've heard this a lot, and people are very concerned about this. A lot of people, especially low-income people, who've been saying, wait a minute, how can the government fine me for not buying insurance? I can't afford this fine. The point is, if you're below that certain level of income, there's going to be taxpayer money that's going to help you pay for insurance that's going to more than make up for this fine. Is that right? That said, there are 14 attorney generals who are on your side if you think, how can the government fine me for it? This is absolutely true. But this is the underpinning of the insurance reform component of healthcare reform. If you don't have everybody in this game, then it just doesn't work. It's that simple. So, you know, we're either going to have health insurance reform and health reform with this mandate, or it doesn't work. Right. The economics of it only work if everybody's insured or that many more people are insured, because you're forcing the insurance companies to make some changes they don't find palatable, and the flip side of that is they're going to get a whole lot more business. Yes, but again, this works. Yeah. All right, let's move on to the next one. Eric M. has a question. Big question from some military retirees. Healthcare is already provided, so how will this new law affect current coverage policies, if at all? Andrew, the number of times I've had this question, people who are military retirees who say, look, what does this mean for me? Clear it up for us. What does this mean for, I guess, the VA system, right, and for people who are currently in the military health care programs? Christine, we've talked about this for a while. It means there are no changes. So if you get your health care through TRICARE, which is for active and disabled military veterans, it doesn't change. You still get your health care the same way. If you're a retired veteran and you get your health care at the VA system in general, doesn't change. No changes. No changes for active military, for retired military people using TRICARE or the VA system. No changes. Christine, I know we're out of time, but I would just love to keep on encouraging our viewers to send us these questions on Facebook and Twitter, because we're going to just keep on answering them. It helps us know what circumstances people are in that need answering. Yeah, and you can email us. Go to CNN.com/yourmoney and email us and let us know specifically what's going on. Because one thing, Andrew and Ali, I think is interesting is there was a lot of heat and hue and cry up until the last few days, and now people are saying, okay, now politics aside, what happens to me and my specific situation? Andrew was saying the same thing on his radio show. People are asking very good and very precise questions, aren't they, Andrew? And they're all great and unique questions pertaining just to themselves. And this is what we needed to happen, so people start to understand what it's all about. All right, Andrew Rubin. Andrew, thanks a million for that. Andrew Rubin is a VP of Clinical Affairs at the NYU Langone Medical Center and the host of Sirius XM Doctor Radio. Okay, so we need to talk about